Accidents can happen anywhere at any time.
A new case has just come into the emergency department. Let's go.
In Sheffield Children's Hospital, 5-year-old Reuben is waiting with his dad.
Looks like you've hurt your arm. What happened?
I fall backward and bang my elbow.
It's been a tough few days, hasn't it, fella? Let's go back to where it all began. Reuben's week started with barely a hiccup, but by Tuesday afternoon, Reuben got into a spot of bother in the swimming pool.
Ooh, I'd make an absolutely fantastic lifeguard, Chris.
Maybe not, Xand. Only real trained lifeguards should ever jump in to help someone. Luckily, one did and rescued Reuben. Then his dad took him to hospital to be checked over and he was given the all clear.
Be you! So why is he still here?
Well, Xand, this is actually Reuben's second visit to hospital because the next day when Reuben was playing tag in the school playground, he ran full speed into his friend James and landed on his elbow.
Ouch! And the award for this week's most accident-prone kid goes to Reuben!
Ready to assess the damage is Dr. Richard Mellors.
Have a look underneath. OK.
He's checking to see where the pain is.
I'm going to press up your arm. If anything hurts, you just tell me and I'll stop. All right. That's starting to hurt there. OK. If you have broken something, what we'll do is take a little picture of the elbow so we can have a look at the bones.
If there's a break in Reuben's arm, then an X-ray will show it.
Find out the results later on. Chris, quick! We need to catch up with our patient in the emergency department. I've even brought some bandages for them.
OK, Xand, well, I tell you what, why don't you give me the bandages and I'll go and check they're all right.
Well, go on, quick!
Earlier, accident-prone Reuben arrived in the emergency department for the second time in 1 week. Reuben was playing in the school playground with his mates when he ran full speed into his friend James and landed on his elbow.
Ouch! He's already had an X-ray.
The X-ray showed something that we call a supracondylar fracture, which is the long bone from your shoulder down to your elbow. It's a break at the very end of it. So you have got a little break in this arm here, so on me, you can see just here is where you've broken it. So yeah, we're going to put you in a pot, if that's all right.
Sister Anna Cowlishaw and staff nurse Caroline Spooner swoop in to set Reuben's arm in a pot or plaster cast.
So we're going to put the soft stuff on first, yeah?
The first layer is a soft bandage, followed by a layer of plaster to hold Reuben's arm in place.
So does it dry up and then it will get harder?
Yeah, it will get harder in a bit once it's dried.
And in no time at all, the plaster has set hard on Reuben's arm.
Ooh, take it easy there, Reuben.
Punchy and breaking it.
There's just one more X-ray needed to make sure the bones are in the correct position.
Looks great.
How's it looking, Doc?
It looks fine actually, Reuben, so the X-ray looks OK after you've had that pot on. So we can let you go home.
Thank you.
That's all right, you're very welcome.
So 2 trips to A&E in 1 week. What have you learned?
Don't run into people.
Good advice, Reuben.
Bye!
A new patient has arrived in the emergency room, Xand.
Right, and I finally found out where the department is. I mean, this way. Over in Accident and Emergency, 9-year-old Sydney is waiting with her mum and baby brother Teddy.
What's up, Sydney?
The back of my earring has gone into my ear.
Like, right into the skin.
Yep. Shall we find out what happened? It was lunchtime, and Sydney was having a rolling down the hill race with her friends Matilda and Ruby.
Chris, what's your favourite hill rolling position? I mean, it's hard to pick because you've got the arrow, straight and sharp to shoot right down that slope.
Right.
Or you've got the octopus, grab the grass with everything you've got to pull yourself down the slope even faster.
OK, thanks, Xand.
Or you've got the chipmunk, where you...
That's enough of that. All I know is Sydney decided to roll with her hands either side of her face, but as she went over a bump, one of her hands pushed her earring right into her earlobe.
Ouch! Here to take a look is Dr. Tom Shaw.
What's happened today?
Butterfly, it's gone stuck in her ear.
Watch out, this next bit is not for the squeamish.
You done?
Told you it was icky and very stuck.
So I'm just going to stop pressing for a second there. I'm just going to go and get a little pair of forceps just to take it out. Okay. Very common thing to happen. Often people don't notice it for a day or two and then they realise their ear's got quite painful.
Dr. Tom's back to try again. Don't worry, Teddy. Sydney's ear is numb, so she won't feel it.
It will be icky, though. Here it comes!
You're all done.
Oh, well done.
Brilliant. Wow.
Well done.
You're so brave, Sydney. So, will Sydney be wearing earrings again soon, Dr. Tom?
She could get her ears pierced again and she could wear earrings again. My advice would be not to at this point, and certainly to let the ear settle down.
Now, Sydney, what have you learnt about the best way to roll down a hill?
Don't put your arms like this.
Yes, I find the arrow position is much better too.
Bye.
See ya!
The doctors in the emergency department thought they'd seen everything.
But they weren't expecting this.
No one was expecting this.
In Liverpool, at Alderhay Accident and Emergency, is 15-year-old Ollie.
Oh, he looks a bit sheepish.
Yeah, well, look what he's done.
Is that a staple?
Yep.
I can't move it, like straighten or anything.
Well, just wait till you hear how he did it.
Ollie was in his history lesson at school doing some research.
Oh, great. Let's learn about Spartacus. Nice outfit.
I know you love the Romans, Aunt, but no, it was 1920s America.
Ooh, exciting. Is he dancing the Charleston?
Actually, Ollie had got distracted at the time.
Oh, so what was he doing?
He was busy stapling sheets into his exercise book when his stapler broke.
Okay, Chris, where's this story going?
Well, while he was trying to fix his stapler, he pulled back the spring and stapled his own finger.
Ouch!
The teacher had a look and everyone burst out laughing.
That's just mean.
Well, here to have a serious look at that damaged digit is Dr. Bimmel Meta.
Hi Oliver, I'm Bimmel, I'm one of the A&E doctors. How are you, mate? What's happened?
Staple.
Right, staple. How have you done that?
I was trying to fix it and I forgot my finger was under it, so I pressed it in.
Doesn't look like there's very much bleeding around it.
Dr. Bimmel checks the sensation in Ollie's finger to see if he's damaged any of his nerves.
Can you feel me touching you there?
Yeah, slightly.
Yeah? Does it feel the same as it does on that side?
Feels a bit more like solid there, but...
Okay.
So, what's the verdict on that staple, Doc?
We're just going to do some x-rays, see where it is in his finger, and then decide what we're going to need to do with it. If it's gone into his bone, then that will need to come out maybe with an operation and a clean, but if it's just missed his bone, then we should be able to pull it out in the department.
Ollie's starting to look a little bit nervous now, but it's important that staple comes out, otherwise it could cause an infection. Like other parts of the body, bones can get infected.
Bone infection occurs when bad bacteria spread to the bone from an open cut or wound on nearby skin.
Or from other parts of the body through the bloodstream. Next, Ollie needs an X-ray.
I can't straighten it.
We won't ask you to straighten then.
Ooh, that is a bit bendy.
Brilliant, that's fine. All done.
Jill, the radiographer, is impressed.
Yeah, that's a pretty good injury, to be honest.
It certainly is.
Find out later if Ollie needs an operation to patch up that painful pinky. Our next patient's day was turned upside down when they had an unusual accident.
Well, let's meet them.
Waiting to be seen by the doctor is 10-year-old Isla with her mum.
I've hurt my wrist here and it's really sore.
She's doing a great job of elevating her hand with that hoodie.
I wonder where she got that from.
I was watching a few episodes of Operation Ouch and I saw it, so I tried it and it worked.
Excellent work. You could be a doctor at this rate. But how did it happen?
Isla was on holiday with her family in Sherwood Forest.
Ooh, home of Robin Hood.
That's right, Xand.
I can picture it now. Robin Hood, riding through the glen.
Actually, Xand, Isla was playing hide and seek.
Robin Hood, with his band of men.
No, Xand, she was with her friends, and there were no horses. She was at a leisure centre in the forest, when all of a sudden, she jumped onto a stool and fell off.
Oh.
And look, she's landed on her wrist.
Ouch!
It's straight down to X-ray for Isla to get some pics of that jarred joint.
Okay, Isla, all finished.
With the X-rays out of the way, here to look at her hurt hand is Dr. Daniel Murray.
Let's have a look. Let's roll that sleeve right up, okay?
Dr. Daniel checks to see where Isla is most sore.
Did you win at hide and seek?
No.
No.
Well, that adds insult to injury.
Make a fist for me, tight as you can.
It really hurts down there.
Hurts down there. Okay, and straighten it out. Is that hurting a wee bit? Very good. Okay, and understand you've been round for an x-ray?
Yeah.
Well, we'll get your x-ray and I'll pop back and have a chat with you and Mum, okay?
Okay.
All right?
So what's the diagnosis, Doc?
Just round about here is where she was tender, and that looks completely normal, okay? You look down there to see if there's any sort of steps or breaks in the bone, and I can't see anything obvious there. Okay, so to me it looks like a normal x-ray, so she's most likely just sprained her wrist when she's fallen on it.
There are 13 bones in your wrist.
Between these bones are ligaments. They're like strong elastic bands which connect bones to one another.
When too much pressure is put on a part of your body, like falling on your wrist, these ligaments can get stretched, twisted or torn.
It's called a sprain, and this is what happened to Isla.
Just giving it some rest, okay? And regular painkillers. Do you do sports at school?
Yeah, we do PE.
You do PE, okay. I'd probably give that a miss for the week, okay? Just to give it a chance to rest, all right?
Isla doesn't look overly happy about that, Xand.
I said I'm not allowed to do dance and sports.
And have we learnt any lessons from this?
Don't jump on a chair.
We'll bear that in mind. Bye, Isla! Our next patient thought today would be another normal day.
But then he ended up in the emergency department, and that's not normal at all. Unless, of course, you work there. Then you'd be there every day. If you were a doctor there, you just go in day after day. Every day would be the same. It'd be completely normal for you, except on weekends.
Sat in accident and emergency with his mum is 9-year-old Matthew.
I fell over and hit myself on the goalpost.
Ooh, off the post. That sounds painful. Let's find out more.
Matthew was in the playground with his whole class.
Sounds fun.
He was sliding.
Ooh, on a helter-skelter.
No, Xand, he was...
On a sledge in the snow.
No, Xand, he was...
On a giant water slide.
No, Xand, he was running really fast, fell over, and ended up sliding into a goalpost head first.
Ouch! It's over to Dr. Mary Ryan again to have a look at that head. You might want to look away now if you're squeamish.
What part of your head did you hit? Oh, the top bit. So look in your eyes, Matthew. So, do you think you can follow this light with your eyes?
Because Matthew had a knock on his head, Dr. Mary is using this test to check his brain is working correctly.
Excellent, good man. Right, Matthew, so you've not suffered any big ill effects from that, okay, and I think you're going to be absolutely fine. You do need to have a little bit of glue on this cut, okay, because it's just a little bit open and there's a little bit of blood, all right, but it's only tiny, so we'll glue you back together and you'll be fine. Hang tight, I'll get someone into you, okay? Good.
Matthew kicks back while he waits for the nurse. Looks quite comfy.
Yeah, it's really comfy.
Don't go getting any ideas, Xand.
Oh, I was just saying.
Oh, hiya, Laura. Okay, I'm just going to glue your head, okay?
Matthew's not looking so sure.
Nurse Laura uses a special medical liquid to glue that gash.
You okay?
Yeah.
Is it hurting?
No.
All done. Should we sit you up? You ready?
Yep.
With that cut closed, Matthew is all fixed up.
Where are you off to, fella?
Probably get a cookie or something.
A cookie?
I think you deserve it. Bye! In accident and emergency, doctors and nurses need to act fast.
Especially when things like this happen. In the waiting room is 7-year-old Sally, who seems to have misplaced her pocket money.
I have swallowed a coin
Go on.
and I don't know how to get it out.
Well, how did you get it in?
Well, Xand, what happened was Sally's mum gave Sally a £1 coin for her pocket money.
Ah, nice. Did she put it in her piggy bank?
No.
Did she buy 100 penny sweets with it?
Nope.
Did she use it to hire a supermarket trolley?
No, Xand. Sally decided to use the coin to play catch with. She threw the coin higher and higher.
Wow, that is very high.
I know, Xand.
I'm not sure the Queen's enjoying the ride.
And when the coin finally came back down, Sally ran forward to catch it, but it missed her hands and went straight in her mouth.
Ouch!
Don't worry, Sally. Here's Dr. Alan Grayson. Let's see if he can help you get a refund.
Since you swallowed the pound coin, how has your breathing been?
It's been okay.
Can I have a little listen to your chest? Is that all right? You take some big breaths like you've been running.
Dr. Alan needs to check that the coin isn't affecting Sally's breathing, because that could be dangerous.
When you swallow something like a nut, it goes down your throat, into your esophagus or food pipe, and then into your stomach. And Sally's coin may have done the same journey, but it could go down her trachea or windpipe and end up in her lungs, which would cause her to choke.
That all sounds normal.
Good news, but Dr. Alan needs to find out exactly where in her body that coin is, so it's off to X-ray.
So this is my camera, so I'm just going to see if we can see your coin.
Show me the money.
There it is. What do you think, Nurse Faye?
You definitely swallowed a coin.
The coin was in my belly.
And that means it's past her windpipe and there's no risk of it ending up in her lungs. So it's back to Dr. Alan to find out how to remove the coin.
It's going to come all the way through your tummy and out into the toilet, probably in about 2 to 3 days' time.
Is something on your mind, Sally?
What if it fell in the toilet and it was very dirty?
What we usually say to people is don't try and get it back out of the toilet.
Well, I've heard of spending a penny, but never a pound.
If I go to the toilet, the money will, like, appear in the toilet.
That's money down the drain. Try keeping your pounds in your purse next time, Sally. Bye!
Medical teams always expect unexpected cases.
And this one is a real jaw-dropper. In the emergency department, the air ambulance has arrived with 8-year-old Mackenzie, who got stuck on a fence and has wounded his chest.
Ooh, nasty. How has that happened?
Well, Xand, it's all about frogs. Mackenzie just loves them.
Me too! Hey, Chris, what's a frog's favourite game? Cricket, cricket.
Very good, Xand. But this is about Mackenzie, who was playing with his friend Spike, and they were heading to the frog pond.
Sounds riveting.
They were climbing over a fence.
Chris, that doesn't look like the kind of fence you want to climb over.
No, Xand, it's not. But Mackenzie decided to have a go anyway. He stepped on a wooden block to get over it, but just as he got to the top, the block broke and he got stuck on a spike.
Ouch!
The team gets straight to work assessing Mackenzie for serious injuries.
Consultant Dr. Sarah Jones is in charge of the trauma team today.
She feels around Mackenzie's internal organs to see if the fence has damaged any of them.
How big were these spikes?
The middle one was that big. The side ones were like that big.
Our main concern is we don't know how deep this wound is, and there is always a potential that if the wound is deep, has it gone deeper than muscle? Has it gone into the chest or has it gone into the tummy?
To assess whether any damage has been done inside Mackenzie's body, Dr. Sarah uses an ultrasound machine.
Press here.
Everything seems okay, but to be sure, a more detailed picture of Mackenzie's insides is needed.
In cases like this, an X-ray machine is brought to the patient, as it may be dangerous to move them.
The X-ray will help the medical team to find out if the cut has caused any serious injuries.
Underneath the skin on your chest, you have 12 pairs of bones making up your rib cage or thoracic cage. They're all protecting your vital internal organs.
Normally they keep you safe, but the spike may have gone through these and done some damage to Mackenzie's lungs, his liver or his diaphragm.
We'll catch up with Mackenzie later to find out the results of his X-ray. Ouch. Chris, I wonder how our patient's getting on in the accident and emergency department.
We don't have to wonder, Xand. We can just find out.
Earlier, we met 8-year-old Mackenzie, who had been airlifted to hospital after getting spiked in his chest.
He'd been heading to a frog pond when he tried to climb over a fence.
The wooden block he was standing on broke, and he got stuck on a spike.
Here to assess if Mackenzie needs an operation is surgeon Fiona Murphy.
So is it hurting beneath my fingers? Was it hurting a bit further up where your cut is?
A bit further up where I got it.
Yeah. He's got a very small cut, but sometimes that can be deceptive because it can look very small, but it can go deep. So that's why we had to do some more tests to check that it hadn't gone any further than we were expecting.
Surgeon Fiona takes a look at Mackenzie's chest x-ray to see if any internal damage has been done.
We're wanting to make sure there's not a leak of air around his lungs, there's no black line, or that the lung is not collapsed, and there's no white stuff in his chest that would suggest blood.
It's good news. The x-ray is entirely normal. Mackenzie's cut isn't deep enough to have affected any of his internal organs. But because Mackenzie has had a potentially serious injury, the doctors want to keep an eye on him overnight to make sure he doesn't develop any further symptoms. So, it's a night on the ward for our patient. And the next morning there's good news.
They may be better, and now I'm feeling all right, so I'm good to go home.
And what have we learned from a dramatic trip to hospital?
Never climb metal gates.
I think that's a great idea.
Bye! In A&E, our next patient has had an unusual accident.
Luckily, she's in the right place. In Sheffield Children's Hospital, 12-year-old Isabelle has arrived with her dad.
Ooh, she looks a bit mucky.
What's gone on there, then?
I've hurt my hand. I don't know, I'm not sure if it's going to be broken or not.
So, how did she manage this muddy mishap?
It was a beautiful spring day, and Isabelle was out with her horse, Harvey.
Oh, that explains the muddy boots, then. Hey, Chris, where's her riding hat?
She wasn't wearing one, Xand.
Oh, that's not a good idea.
I know, but off she went. There wasn't a cloud in the sky. Flowers were blooming, lambs were frolicking, birds were tweeting.
I can't see what the problem is here, Chris.
Just wait, Xand, because all of a sudden, Harvey bolted.
As fast as Usain Bolt?
Well, kind of. Isabelle tried to stop Harvey, but she couldn't. She was dragged along. Harvey trampled over her hand.
Lucky she didn't bump her head, Chris. Ouch!
He's quite feisty, yeah.
No kidding.
It's time for Dr. John Griffiths to check out Isabelle's hand. What do you reckon, Doc?
Right, I'm just going to prod and poke, and I want you to tell me if there's any soreness, all right?
It starts to hurt about there. Yeah.
Dr. John checks for any nerve damage.
Does it feel the same on both sides?
Tickles more on that side.
Tickles more on that side. There is a chance that she does have a fracture, but we're going to do an x-ray and find out.
This is the stuff nightmares are made from.
Oh, Xand, enough of the horse jokes. It's off to the X-ray department to find out what the damage is.
I'm going to start with your hand and then I'll do your wrist, all right? Okay.
There are 27 bones in your hand. 8 of these are in your wrist.
Any of these bones could have been broken by Harvey's hoof.
But it's the left side of Isabelle's hand that Dr. John is most concerned about.
So, if we look at the bones, there's no real breaks in the bone, all the lines are nice and smooth. So, I think you've probably dodged the bullet.
Or a bolting horse, more like.
Great news, Isabelle. Everything looks A-OK. A simple splint to support Isabelle's wrist for a few days, and she'll be on the mend.
Thank you.
Take care. See you later.
Isabelle's got one last message for her main man.
Harvey, I'm not impressed.
I'm not surprised.
You are a little pony there, and I won't hate you forever.
Oh, let's saddle up and get out of here. Bye.